Hi, my name is Brian McKinstry and I'm one of the directors of Share, and I'm going to tell you a little bit about Share. We know that researchers have great difficulty in managing to recruit people. It's one of the biggest problems that they face. But we also know there are plenty of patients out there who would be interested in taking part in studies if only they knew about them. And that's why we invented Share. So what's Share? Share is a register of people who are aged 11 or over and they live in Scotland who wish to help with medical research. They have given permission to use the codes in their NHS data to establish whether or not they're suitable for particular research projects. Some of these people, in fact the majority, have also allowed retention of any spare blood left over following routine clinical tests to be used for research anonymously, and we'll speak about that later. So where are we with Share at the moment? At the moment, we have almost 300,000 people throughout Scotland signed up to Share to help with medical research, and they've all given permission for the records to be used in that way. We've collected around about 100,000 blood samples. And in the last 18 months, we've facilitated over 25 studies during lockdown, a wide variety of studies. So how, as a researcher, do you access Share? It's very simple. You go on our website and you click on the button that says Researchers. This takes you to a screen which summarizes the numbers and ages of participants we have in different health boards, the conditions they suffer from, the types of medication they use. This can give you some idea if we are likely to be able to provide a sufficient number of participants for the condition in which you're interested in the area in which you wish to conduct the study. This next slide summarizes the major conditions from which Share participants suffer from. It also shows the medications that they take. Share derives its data mainly from hospital discharge data, which is considered to have the highest accuracy, but we can also get information from up to 14 data sets, including general practice data. Not all conditions are equally well coded, and so it can be helpful to use prescription data to identify potential participants. Migraine is a very good example of this, as it is a condition that is poorly coded, but is treated with very specific medications. Look at the age distribution. We largely recruit people from outpatient clinics, and this population pretty much reflects that. So we have more women than men because women often accompany other patients to the hospital, and it tends to be a slightly older group that have diseases. However, we're working very hard to try and improve the numbers that we have in the younger age groups and to increase the number of men. Applying to use Share is very straightforward. We ask you to complete a very short online form. The study summary can usually be lifted from a grant application or ethics summary. We ask you to provide the codes you would like us to use to find the patients for you. We can offer some assistance with that if necessary. All projects that Share supports would normally have to be eligibly funded. However, we will carry out baseline searches at the grant application stage for researchers who want to know if Share can help them conduct a study for which they are applying for funding. So the approval process is very quick. So after you've filled in the application form, sent us a protocol of your study, assured us that ethics has been either at least applied for, and that R&D approval is also applied for. We'll have a look through to see whether, in fact, there's some potential for us to help you or not, and that would be free just to have a look through to see whether we've got sufficient patients to help you. We will discuss a pricing structure with you. It depends really on how much work it involves. Some studies require a great deal of additional questioning of patients, and others don't. And it really depends on how much work we have to do as to how much we charge. We're a non-profit organisation, and we really only recover costs. The application is sent to our committee, our access committee, and they are very, very quick at getting back. So you would actually likely get a response within a week from your application. So if in fact you decide to go ahead with the study, then we send this to the Safe Haven for data linkage, and they detect which patients are likely to be helpful. And they put this on a web-based password protected tracker. So then the Share Studies team contact each person, and they discuss the study with them, asking any additional questions that may be required at that time. And if the patient is interested in taking part in this study, then their details are sent to the research team. So the big advantage to the research team is that they know that the people who are coming to them are interested. They know they've already been told about the study and what it likely involves. They're also told the best time to contact that patient to get them to come in. We keep patients on a tracker, so we know where they are. So if you do admit someone to your trial, then we will remove them generally from our database and not ask them to take part in any other research. And we will put them back when we believe that the patient has come out of your trial. Certain types of trial, certain types of study, we will let people take part. So, for example, if it's a questionnaire study, we might send them that. Thank you very much for listening. And if we can be of any assistance, get in touch. We're very happy to run a quick feasibility, let you know whether your project is one that Share can help you with or not. And the contact details are here. Thank you again.